Hi, welcome to this short video about EPaCCS. I've been asked to present this video to you. My name's Rachel Shovelton. I'm a community end-of-life educator and I work with the end-of-life team. EPaCCS, Electronic Palliative Care Coordination System. It's a bit of a mouthful, which is why we always abbreviate it to EPaCCS. The system relies heavily on the information inputted by yourselves across the community. It includes all end-of-life care wishes from somebody. It includes capturing all those important snippets of conversations that you've grabbed with some of your patients and the people in your care. It includes details of a person's illness, diagnosis. It can include key contacts of next of kin. It can also include key contacts of key workers, including health professionals. It's vital to include things like medications, whether just in case drugs have been prescribed, if so, when. It can also include advanced care planning, if that's been documented, if there's an advanced care plan that's been completed and when. It can include preferred place of care, preferred place of death, and so on. It's vital to communicate all those details for somebody for their end-of-life journey. It's really important that you ensure that any information that you've captured, no matter, even if you feel that it feels insignificant at the time, it can actually influence some decisions made along that person's journey in those last few weeks and days of their life. You do need consent from the person. If somebody lacks capacity, of course you need to look at a best interest decision. You need to complete the form, the home visit form. That's under review, and there's a team busy working at reviewing, including ceilings of treatment, which there's a separate presentation about ceilings of treatment. It also includes the Rockwood Frailty Scale. There's also some presentations about that if you're a little uncertain. There are some points that you might stumble, possibly preferred place of care, indeed preferred place of death hasn't been discussed by either yourself or the person before. Of course, it's an emotive topic and not everybody feels free and easy to be able to speak up. Not everybody as a professional feels able to attempt that conversation. But once you've tried it a few times with a few of your patients, I'm sure you will become the expert yourself in how to communicate best with your patients. It's all about really how you can gather the information and how you input the answers that we actually need, part of the home visit form. I'm sure most of you in your teams and in your practices, in your group practices, in your teams, you will have some links for end-of-life care. If you haven't got an end-of-life lead or link, it might be a really good time to start considering who that could be. Maybe that's going to be yourself. I would suggest that because it would make it very easy for that person to be the go-to for support with this. And of course we can liaise with them with our team too. EPaCCS is one place for information. It's the right place to determine where somebody ought to be for their care, and it ensures the safe and caring place for somebody to die. Here's a small analogy about Jigsaw. During COVID, many people spent lots of time building jigsaws. I know myself, I did with my family. So imagine now you have a jigsaw. The jigsaw represents the patient, your patient. We'll call him Fred. Fred lives in his own home. He's got a couple of diagnoses which may include some life-limiting illness, certainly long-term conditions, certainly some issues around shortening his lifespan. You anticipate that Fred is likely to die within the next 6 months. and you feel that you ought to include all his details and information on an EPaCCS. Possibly at the moment you look at the jigsaw and there are many pieces missing. You try and put the edges around the jigsaw, maybe the basic details that we have about Fred: name, address, date of birth, GP, key practitioners involved in his care. Most of the jigsaws of your patients will look the same at this point. Let's imagine now you don't actually have a picture on the front of a box to be certain what the overall picture should look like. It might be that you've not been able to gather all the information that you need to form that full picture. Imagine it's now split into smaller pictures, and that could be different elements of Fred's care and needs and wishes. It might be that you were able to fit in some extra pieces after a conversation with Fred. It might be that Fred becomes unwell one evening and his family member visits him in his own home and finds him in quite a serious state and appearing very unwell. They call out of hours or indeed the ambulance service, but nobody has any information fully on Fred. Nobody has a full picture of what Fred's wants, wishes are. Nobody has a full picture, indeed, of your professional view on what Fred's end-of-life journey could look like. What would Fred want? How do we inform people? And how can we share that information? Well, EPaCCS doesn't bring all the answers, but it's certainly an excellent start. Imagine now that phone call that the family member makes. Fred is rushed to the emergency department and he later dies in urgent care or A&E. You get the information on this the week following and you are disappointed and possibly feel that you have let Fred down. Possibly you'd had a conversation on the latest visit that you had with Fred or the latest call that you made with Fred, and Fred mentioned that he felt he was deteriorating and could we please make sure that he didn't die in hospital. Unfortunately, that information wasn't inputted into any system, nor was it communicated to anybody. And of course, the end result is that Fred doesn't get what he wishes. I'm sure you wouldn't like that for Fred. Fred certainly wants what he wishes for. You get the idea. If only we can fill the rest of the jigsaw pieces in, if only we can fill in the gaps, if only we can make sure that the completed picture, the completed jigsaw is passed on to colleagues so that should Fred become unwell, should a phone call be made to out of hours or extra help, then maybe the picture will look very different and Fred will eventually be cared for in the place that he needs to be. So back to what can you do? Well, you can ensure that the home visit forms are completed. You could look at having an end-of-life lead within your team. You could get in touch with our end-of-life team. We're always happy to help. If you've got any questions, if you've got any further wishes regards to training and education sessions or even presentations, we're more than happy to help. Thank you.